Hey everybody, it's Dr. Levitt here, and I have important information to share with anybody who has ever had a pain in their knee. Now, this is especially important for people who've been told that their knee pain was related to osteoarthritis, degenerative joint disease, or even meniscus tears in the knee. Now, keep in mind, this is a very, very common problem, and many people who have meniscus tears or arthritis in their knee are referred out for an MRI for evaluation. Now, there's a funny thing that happens. Think about this for a minute. When a patient has a pain in the knee, and then gets an MRI or an X-ray that demonstrates evidence, an image that shows an abnormality like arthritic changes or a meniscus tear, what happens in the mind of the radiologist and in the mind of the doctor, and most certainly in the mind of the patient, is that those two things, the pain and the abnormality that we see on the image, let's just say it's a meniscus tear, are tied together. They're attributed to each other. The pain must be the result of the meniscus tear, right? It makes logical sense, and there is one fundamental problem, though, that very often it is simply not true. There are legions of people walking around with meniscus tears who have no pain whatsoever. Now, this isn't just me saying this. There are mountains of scientific data that show that approximately 40% of people age 40 and 50% of people age 50, 60% of people age 60, and so on, are walking around with painless meniscus tears and osteoarthritis in their knees. Now, what makes these people have painless knees even in the setting of arthritis and meniscus tears, and in other individuals who have arthritis and meniscus tears can have exquisite amounts of pain? So there's a fundamental difference there, and I think the big problem lies in this idea of attribution error, right? Where we think we see one thing on an image and we think that's what's causing the patient's pain. And like I said, quite frankly, it's not true. So in so many of these individuals, what is the cause of their pain if it's not the arthritis or if it's not the meniscus tear? Well, I'll tell you two of the most common. Number one is inflammation. Some people have more inflammation in a knee or in other joints than other people, and this inflammation can be moderated or modulated in a number of different ways that have nothing to do with pharmaceutical interventions, but have to do with things like maintaining a proper weight and maintaining a good anti-inflammatory diet. That means eating anti-inflammatory foods and avoiding pro-inflammatory foods, stress reduction, good sleep, healthy physical exercise. These are all things that can have a positive impact on the inflammatory response. The other thing, a very commonly overlooked cause of pain in a knee, has to do with muscle tension. Tension or trigger points in the muscles of the quadriceps in the front of the thigh, or the hamstrings in the back of the thigh, and the calf muscles as well. Very often when these muscles get tight and stiff and sore, they put pressure on an already problematic knee that might contain arthritis or might contain a meniscus tear, and can make that meniscus tear unmask, or it can cause it to become painful. So stretching or massage techniques or trigger point release techniques and physical therapy can be incredibly useful to decrease pain in a painful knee, even in a person who has evidence of arthritis or a meniscus tear. So keep in mind and talk to your doctor about this idea of attribution error if you ever get told that you have arthritis or a meniscus tear in a painful knee. I hope that helps you. Take good care.